Hi, guys. Um, my name is Sanjay Gupta. I'm a cardiologist in York Hospital. Over the past few months, I've been doing a series on how to get rid of your palpitations naturally. I am at the moment quite disheveled because I'm actually in San Diego attending the American Heart Association, American College of Cardiology Congress. There's been a bit about ectopic beats and palpitations at the Congress, and I just wanted to keep you informed as to the effect of stress and anxiety on symptoms of ectopic beats. So I'm sitting in my room in San Diego, and it's very early in the morning, so I apologize for my disheveled appearance. Right. Now, the first thing to say is that this is a video for those people in whom you have had your palpitations defined, i.e. you've been checked out by a cardiologist, and at the time when you've had your palpitations, someone has done some monitoring and said your palpitations are due to either ectopic beats, which are benign, or due to just a fast heartbeat, which is of normal rhythm. Okay, if you have an abnormal rhythm at the time of your palpitations, a pathologically abnormal rhythm, which your GP says or your doctor says is abnormal, then that should be treated for its own sake, either with medications, or you need to go and see an electrical heart specialist, electrophysiologist, and get that treated. This video is for those people who form the majority of patients with troublesome palpitations, in whom the GP or the doctor says, oh, these are just ectopic beats, forget about it, or they're not dangerous. And the problem that brings is that for a lot of people, that reassurance is not adequate because they're still left with their symptoms. Now, during the course of making these videos, I did a lot of reading, and I looked at my patients more carefully. And the one common theme that runs amongst the majority of my patients is that they admit to being anxious about their health. So they have a degree of health-related anxiety. And that may be brought on because of someone who is close to them who has prematurely died. It may be because they're going through a major life event. But the majority of patients, more so than any other etiological factor, will say that, yes, I do tend to get anxious about my health. Now, the problem with anxiety and stress is manyfold, okay? The first thing to say is that when you get anxious, your body's natural response is to release adrenaline, okay? And if one of the things to know about adrenaline is that it will increase the activity of the heart. And if you have ectopic beats happening at that time, then your ectopic beats will become more frequent. And that is partly because of the adrenaline, and partly what it does to your serum iron or your body magnesium and potassium levels. I'll talk you through it. If I took 100 normal people off the street with no symptoms whatsoever, and I did a Holter on them, or I did a monitoring on them, then you would probably find that in virtually all 100 patients, you will see some ectopic beats. So ectopic beats are not uncommon, okay? They happen. The sensation of ectopic beats is abnormal, i.e., when you start sensing them to the point that the symptoms become troublesome, that is abnormal. But ectopic beats themselves happen in all of us, and they in themselves are not abnormal. In fact, I'd find it abnormal if someone didn't have a single ectopic beat over a 24-hour period. Some people get very frequent ectopic beats, and that really needs to be investigated further by means of an echocardiogram, where you look for the structural side of the heart. But the sensation of ectopics is abnormal. And interestingly, we have done lots of Holters in people who complain of ectopics or extra beats, And in some of them, you actually find that they have a normal heartbeat when they're complaining of symptoms. So even having a normal heart rhythm can manifest as palpitation. So the majority of people with these sort of benign rhythms are either complaining of a sinus tachycardia, i.e. the heart rhythm is normal when they're complaining of their palpitations, or they complain of ectopic beats, which are being sensed abnormally. And if you go back and watch some of the other videos I've done, I've talked about ectopic beats in a bit more detail. So the thing with adrenaline is it increases the heart rate, and it will also increase your awareness of your heartbeat. So if you have a normal heart rhythm, having adrenaline will increase your heartbeat, and you will sense it. So it's the same as being scared. It's the same as walking along a dark alley and having someone jump out at you. You get a sudden adrenaline rush, you get palpitations. Your heart rhythm, which is normal, goes faster, and the heart beats harder, and that is sensed as abnormal. If you have ectopic beats and you get an adrenaline surge, then two things happen. One, the frequency of your ectopic beats will go up. The second thing is that you tend to hyperventilate because, again, your body is prepared for the flight or fright response, and you tend to hyperventilate. And the problem with the hyperventilation side of things is that when you're hyperventilating, you're blowing off a lot of carbon dioxide, and your body pH, the amount of acidity or how acid or alkaline your blood is, changes. And that in itself can be a really powerful trigger for causing more palpitations, causing more ectopic beats. The other thing to remember is that when you have an adrenaline surge, then magnesium comes out of your cells and gets excreted in the urine. Now, we're all probably not having as much magnesium as we should in our diet, but when you start getting very stressed or have a lot of adrenaline in you, then the magnesium, which is bound to your bones, etc., comes out and gets excreted out, and you develop a magnesium deficiency at that time. And that can, again, be a stimulant for causing more ectopic beats. The other thing to say is that when we look at inflammation within the body, we know that stress and anxiety are very inflammatory to the body. So people have done lots of tests where they've measured inflammation levels, and your stress levels, as your stress levels go up, as your adrenaline goes up, as your cortisol, which is another stress hormone, goes up, the amount of inflammatory markers go up. So your body starts fighting against itself. And when that happens, then that can also cause lots of electrolyte disturbances, affect your magnesium levels, and can cause more in the way of palpitation. So how can you use this information to try and make things better for you? Well, the first thing I'd say is, if you are feeling anxious, if you are finding that your ectopics are getting worse, the first thing is not to worry, okay? Nothing bad is going to happen to you. You're not going to drop down dead. You're not going to suddenly, have a heart attack. And this is really, firstly, for people in whom your heart has been checked out, and you know that your heart is otherwise strong. You've had an echocardiogram, you have a strong heart, you haven't had heart attacks in the past, no one has said you have heart failure. In those people, if you start getting a run of ectopics in the middle of the night, then the first thing is to calm down, okay? Nothing bad is going to happen to you. The second thing to do is to become conscious of your breathing, and try and slow your breathing down if you can. So you take deep breaths in through your nose and then breathe out through your mouth. And as you do that, you'll start calming down. One of the typical signs of hyperventilation is that people start complaining of tingling in their hands or numbness around the lips. And so a lot of people say, oh, well, I got the palpitations and they were going really fast. And then I started developing tingling in my left arm, and I was so worried I was going to have a heart attack. And what's going on there is that's propagating itself. And therefore, I would say that be conscious of your breathing. That's the first thing. Slow your breathing down if you can. The second thing to say is try and do some activity. A lot of people go and lie down when they get this, and the reason they lie down is because they think, oh well, I'll lie down and it'll go away. Unfortunately, it doesn't. It gets worse, and the reason it gets worse is because you're thinking more. What you need to do is to try and get busy, so that your mind is taken off things, your cortisol and your adrenaline levels go down, and then you'll find that the palpitations just wear off. Okay. Of course, it's also a good idea if you are getting a lot of these in the context of being stressed or anxious, is to see if you can go on a magnesium supplement, because that can help. I would also recommend that for a short period of time, a trial of beta blockers is usually a good idea, because beta blockers are anti-inflammatory. They're, they counteract the effects of adrenaline. They slow the heart down, and in so doing, they can break that vicious cycle where you're conscious of your symptoms, you get more anxious. As you get more anxious, you get more symptoms. So taking some beta blockers for a month, 6 weeks, something like that, coupled with magnesium supplements and breathing exercises, can make a big difference. A lot of people go to their GPs, and the commonest thing the GP does is give them a medication, an antidepressant or an anti-anxiolytic. And I would prefer that to be the last option, because why do you want to take more medications? And a lot of the antidepressants, a lot of the anti-anxiolytics, they themselves can affect heart rhythms. So I would suggest that you try and do it naturally if you can. Pay good attention to your diet, try and eat less processed food, try and eat less food with preservative, try and get good sleep. And that's the other thing to say, that a lot of people will find that they get very anxious, they lie in bed, they don't get sleep. If they do get some sleep, they wake up very early in the morning, they lie in bed, they notice their palpitations, they get more anxious, they get stressed, then they spend the day being tired. Because they spend the day being tired, they come home, they lie down, they probably cut corners in terms of what food they're eating. There's a greater propensity to take in caffeine because you're tired and you need that caffeine as a pickup, but then caffeine again will contribute. So there's so much that propagates itself as a result of anxiety and stress, that just being aware of this and trying to break this vicious cycle can make a huge difference. So I think that's all I have to say. I'm very grateful to you for your comments, and I will try and answer them all. It's just I've been busy in San Diego at the moment, so I will try and answer all your calls. If you need to get in touch with me, you can do so through my website, which is www.yourcardiology.co.uk. My secretary's number is 01904725811. And I'm grateful to those people who got in touch with her, and we've had some really good consultations. I'm also on Twitter. I'm not really good at tweeting, but this is my Twitter handle, and I'm also on Facebook. And the last thing to say is, if you've enjoyed this video, please subscribe to my channel and tell your colleagues, tell other people, because people have found it useful. And it may be that if you have anyone that you know who's suffering from palpitations, then this video may be helpful. And that's about it. So I wish you a good night, and I'll try and do my next video very soon. Thank you. Bye.